This is Dr. Ben Pearl with FitFootU. So we're going to take a look at a cellulitis, a diabetic foot infection today. This situation has been going on for several days. The patient was given Bactrim at the urgent care. With diabetes, you always have to be managing how severe it is. So we've drawn a tide mark, and we're going to show you this in a moment with a magic marker to monitor what we're going to do. And in this case, not only am I going to drain the abscess on the toe, but I'm going to add a drug called omadacycline. It's a new generation tetracycline. So you can see the extent of the cellulitis. It's not just the toe, and even the faded red here, it's going all the way up to the midfoot. So we're going to lance this, and we've already lanced it and obtained a culture, but sometimes you have to score it several times in order to get all the drainage out. And you can see from the drainage, it's not just serous, it is somewhat opaque. So we might get a culture out of this that will lead us to some more information that can help us. And then we, of course, also get blood work. We'll get a CBC. She's already had her sugar, which is 126, which is reasonable. And then we'll go from there. As you can see, we've thoroughly de-roofed the abscess. Now, as we already mentioned, we've added another antibiotic. There is a hole for streptococcus with the Bactrim, so that's why we've added the omadacycline. Omadacycline also has the property of helping with inflammation, and there's a lot of inflammation with this, with the cellulitis. So this is something that we'll manage for now until we get blood work as an outpatient, and then we'll see her this week to make sure things are improving with the addition of the antibiotic. This is day 3 on omadacycline, and if we look closely, we can see the return of skin lines. The tide mark has went down significantly. This is a great initial result here. Things are drying up a little bit on the abrasion there. And the white count was reasonable at 9. The CRP was elevated, 12.9. But things are moving in the right direction here.